Megan from Aspire Health and Rehabilitation. I'm going to be showing you a modified version of the couch stretch that I previously had up on our Facebook page and our website. Essentially, it's a great stretch for your hip flexors. Okay, those that do a lot of running or cycling, especially up like hills and stuff like that, where you tend to burn the hip flexors a lot, is really good for that. Especially those that sit down a lot through the day, so office workers, people that do a lot of driving, stuff like that will be really effective, because when you are sitting down for long periods of time, you kept in that trunk flex position, and you got that muscle on a shortened position, so it's quite short. So you need to be able to stretch it out. Okay, so I'm going to be showing you the modified version. There is a full version up on our platforms, and you can definitely check that out. Essentially, you're going to be using a wall, or you can even use a pole or a rack, depending on what's available. And you're going to be getting down to the floor. You're going to be putting your foot up on the wall and having the knee out 10-15 centimeters, whatever it is, away from the wall. In this position, you will be bringing your knee up like that. You can have like a chair or a bench, something to hold on to for balance. Essentially, you're going to be up into this position, and you're going to be stretching out through the hip flexors. Now, a lot of people tend to try and get up as high as they can go, but they tend to really arch their back into a hyperextended kind of position, and they just lose that alignment in the spine that you need to keep. So depending on how you position, you need to be getting up nice and tall, but just be mindful of that back position. And essentially, you're just going to be holding this position up to 30 seconds and doing it a number of times each side. So again, getting into this neat position, foot on the wall, the full cap stretch position. The unmodified version is actually getting up into the crack of the wall, but this modified version is a little bit away. I have a lot of patients that can't get the knee into the crack of the wall, so this is a lot better for them. Coming up into this position, sometimes this stretch might be enough, just holding this position. However, you can get up into that full stretch. You can place your hands on the knees or hold onto something, but you really want to make sure that you keep a nice spinal alignment, and you'll really feel a stretch through the hip flexor there. Thanks for watching. If you want any more access to other videos and articles, check out our Aspire Health and Rehabilitation YouTube page. We also have a website, www.aspirehealthrehab.com.au, and you can also give us a like on Facebook and Instagram.